Hey guys, it's Pete from Pete for Anxiety here, the mental health podcast, breaking the stigma that mental health is talked about. Welcome in today's episode. Before we get started today, we need to cover a few things really quick. Let's talk about the Pete for Anxiety Patreon first off. It's only $1, guys. $1. What does $1 get you? $1 gets you into the exclusive episodes I am recording currently. I'm actually focusing on certain different diagnoses of things to show you guys what it actually looks like as it manifests in a person. So why not for $1, judges? Yeah, they said $1. I just checked for them too. See, they said it was okay. It was $1 anyways. Let's also talk about the Oracle Talk Radio Networks app. In case you can't be here live listening to me, watching this video, supporting the show, you can listen to it on the radio app. Why not? It connects us live to our 365 radio. Just go to your app stores and download the Oracle Talk Radio Network. You'll see the big old Oracle Talk Radio Network app logo right on there. Download it and it'll connect you to me, 10 a.m. Central Standard Time, 3 p.m. Central Standard Time, to Pete for Anxiety when I'm live doing my thing right here, informing the world and raising mental health awareness. So where are you going to be? 10 a.m., of course. Come on, we just talked about this. Pay attention for once. Damn, do you all know how to listen? And as always, guys, like, follow, and share the YouTube channel. If you guys like what you're seeing, leave some comments, man. We want to know. I want to know if you like what on. You want to be on the show? Let me know. Hit me up at PeteVersusAnxietyPod@gmail.com. And as always, guys, enjoy the show. And by the way, did I mention to like, share, and subscribe to the YouTube channel as well? Yeah, okay. I just want to make sure, because some of y'all are hard of hearing in the back, may have to yell loud or get a megaphone or something. But, anyways, let's get today's show started. Y'all have a great one. Enjoy. Hello, and welcome into another exciting episode of Pete vs. Anxiety, the mental health podcast, breaking the stigma. The mental health is really talked about enough. My guest today is a mental health therapist specializing in neurodivergence, trauma, teens, forensics, substance use, and suicide prevention. Please welcome the one, the only, Kesley Rogers. Kesley, how are you doing today?
I'm doing well. How are you?
Doing really good. And guys, before we start today's conversation, massive trigger warning, because we are going to be discussing suicide prevention in teens. So in case you're listening to this, I just want to give you a heads up that this conversation is going to get a little nitty gritty. And I just want to make sure nobody is going to walk into a conversation they're not prepared for. So Kelsey, why don't you tell everybody a little more about yourself?
So I am a mental health therapist. I'm currently have my own practice, Denny Counseling. And I am licensed in Tennessee, so meaning that I can only see patients in Tennessee right now. I have had my own practice for about 9 months now. And before that, I worked in inpatient hospitals. I worked outpatient. I did a variety of different things at all, I have touched almost every level of treatment that the U.S. mental health system offers.
That's pretty good, though. I mean, that's not that bad. So your own practice, that's always awesome to see. How are you enjoying it so far? Is it something different now that you're the boss in charge versus being someone else being in charge of you?
Oh, yeah, it's definitely different for sure. I feel like I'm able to offer a different level of client care because I don't have a boss who is worried about the bottom dollar and worried about all of the political side of things or the insurance side of things. It's more so I'm able to kind of have that my own judgment and my own say so over my caseload even more than I did before.
Yeah, that's always good. Being your own boss, making your own decisions. And you're right. I think a lot of that is just a lot of people are worried about certain things, just depending on what it is, a lot of red tape that comes with it. But I mean, I think it's going to be great that we're about to have this conversation that I don't think a lot of people talk about, though. Suicide prevention, it's interesting because every time the topic is brought up, you'll get different responses. Sometimes you hear, oh, well, I lost somebody recently. And I was live on TikTok. Okay. So this is how this whole conversation started. This is after we had already discussed about talking about this. I had a conversation with a group of people and they were all just talking about it. And you'd be amazed. I think at least 4 out of 5 people said they had lost somebody to suicide. And it was just crazy because they were just yeah, I just recently lost somebody. And it started with one girl that was actually on the show named Olivia. She came on and her and I were talking and she was like, yeah, I just got a call and found out that somebody had, and with TikTok, you got to kind of code things. So, we had to kind of play around the words a little bit, which is kind of funny because for having freedom of speech, we don't have much freedom of speech on there. You can't really talk
Right.
about these things because everybody gets so offended easily. But it's like it's a tough conversation to talk about, you know.
It
Like,
is.
and it's scary. And when you add in teenagers, it's even scarier because it's like, you know, they're the ones that we need to start educating now, which is great because I'm with a nonprofit called Podcast Preventions, and basically that's exactly what we're talking about. It's suicide. It's like, you know, we need to have the tough conversation now with them so they know to either A, identify there's something wrong, or B, let somebody know there's an issue, because when it comes to that stuff, it's tough, man. It's not a fun conversation.
No, I think it's definitely something that's needed, but it's always like the elephant in the room. I think almost now it's even, you know, a scarier conversation sometimes, having conversations with that with your kid or with a kid that you know, over even like dating or sex, even. Like, it's such a taboo thing because, like you said, everyone has such different opinions and such different responses to it. But there is like evidence that the majority of people are somehow affected by suicide, whether that's they've lost somebody, they know somebody who struggled with it, or they've struggled with it themselves. Like, the majority of people in the world have some impact on their life due to suicide.
Yeah, it's crazy though, because I'm looking at some statistics now, okay, and it says that ages 15 to 14, okay, 13.62 individuals are basically per minute, basically are committing suicide. And it's the numbers are just staggeringly crazy if you think about it.
Yeah.
Like, we're losing people for things that are just like we you know, we want to try and prevent. And I think it's more because people don't talk about it. And I think when people do talk about it, they shut down instantly because they're like, well, hey, whoa, this guy's talking about killing himself and everything. But I don't think they realize in reality is that at least they're talking to you about it. Because if they had a plan, that would have been a whole nother story right there. But they're taking the time, they're talking to you. You know, they're at least letting you know that, hey, listen, there's a problem here. You know, you may not want to hear the conversation, but sometimes, you know, you just got to buckle in and listen to what these guys are saying, because a lot of times that's what the problem is. They're not being heard enough, or they feel like nobody notices them, or, you know, or they feel like they're a burden, you know, and things like that. It's just crazy, you know, and sometimes, you know, that helps you just listen to somebody talk about it. You know, maybe it's an uncomfortable conversation for you, yes, but this person's coming to you to talk to you about a problem. And if you shrug your shoulders at it, then you can't turn around and say, oh, well, I wish I could have done more. Well, you could have done more right there.
Yeah. I think it's, especially with teens, if a teenager is coming to you and telling you, like, I want to talk to you about this because I'm having this issue, like, you need to listen and be respectful of that, because that's such an honor that they're trusting you with that information. Really, any information that teens give, like, it's very difficult to build rapport with teens and build that relationship. So if somebody is coming to you and saying, like, hey, I'm having this issue, then, like, listen, because they obviously, like, are trying to tell you something because they trust you.
Yeah, no, I agree. And by the way, guys, it's 1 every 38 minutes, by the way, is committing suicide. And still, that's still a crazy number. You know,
Yeah.
it's insane. Like, that's nuts. Like, that's what's happening. But it's like social media. And I think it's worse now than it was when I was younger, because I'm almost 40 now, okay? So I grew up in the 90s, and we had like AOL. That was it. That's all you had internet-wise. That, and then you get on the telephone and start, you know, talking trash, or you do it in person. Now it's like Facebook, TikTok, X, all these different things. You have different ways for people to come at people about different things, and you know, now you have video games as well. You had that in there. Forgot that too. You know, you got those, and you can bully people there. And it's like, it's so easy to access a lot of people about this stuff, you know, and I think it's insane. I'm sorry, but it's insane to me. It's just like 1 every 38 minutes is just like, that's crazy. We're losing people at a staggering rate, and it shouldn't be like that, though.
No, it shouldn't. I think the numbers show that like 20% of teens suffer from some sort of mental health issue, and that's diagnosable. So, like, how many people are not seeking help? Like, that number is just a minimum, I think. I don't even think that that's an all-encompassing number,
Mm-hmm.
because there's so many people, so many teens who are dealing with all of these things without having that diagnosis and seeking out help. I think I hear about it pretty frequently of just people who like, oh, well, they didn't even have a diagnosis. Like, they didn't even have a mental health issue. And it's like, well, obviously, like, there was something going on.
Mm-hmm.
Like, they may not have seen a professional while they were here on this earth, but like, there was something going on.
Exactly, and I think that's a lot of times what it is. They're not sure what to do. I think that raising awareness is starting with teens and even younger than that just is a great idea, because that way we can start educating them about these things. So, hey, if they start noticing something's wrong, they know when to start asking for help versus having to deal with these things. And, some of the stuff they can deal with is just, a lot of stuff they can't handle. I mean, and a lot of things are caused by trauma issues, and different things will cause other things that spread out from there.
For sure. I mean, especially thinking about our teens now, like, they were in their really formative years during COVID. And so, like, the lasting impact that had on them. So that's one of the things that I see with a lot of teens is just the lasting impact of COVID, how the education during that time has really affected them. The socialization during that time really affected them, really affected their friendships, because some of them, those were the years you create those core relationships, and they didn't have that opportunity. I think the other thing that I see that teens are really nerve-wracking and nervous for them right now, other than like bullying and stuff on social media and expectations on social media, is also school shootings and school safety.
Yep.
That's one thing that a lot of kids are going into this, like, I don't know what to do.
Yeah.
Because they're in this state of like, this is supposed to be a safe place for me. I do feel like it is a safe place most of the time, but there's this chance that this will happen.
Yeah, and it's crazy when it comes to school shootings. It's just like there's so many now versus like Columbine was a big one for us when we were kids and around that age when I was a teenager. That was the one thing. And I remember when it happened, it was everywhere, and it was just 3 kids that were upset about getting picked on and things like that. And it gets deeper than that too, because I had a guest on the show in the early stages of this that I recorded with. She was actually in the library with one of them. And what her side account was is that they said originally they were going to blow up the library. And I was like, oh shit, dude, okay. And she's describing the story, Kelsey. She's telling me about this. This girl is about maybe 6 feet away from one of the shooters. Okay, mind you, this conversation we're having, as she's telling me, I'm like, oh shit. I'm like, I'm feeling this. I'm like, oh crap, we're in the library. Where are we at? She's like, I was under the table, underneath chairs, and one of the guys had come in there, and she's like, I could see the whites of his eyes. I'm like, hold up, you can see the whites of the eyes of this guy? And she's like, yeah, I can see the whites of his eyes. And then he shot somebody in front of me. I was like, what the hell is going on right now? And it's just like, it started ramping up. And I was like, oh shit, my anxiety is kicking in. And I'm like, I'm not even in this situation, man, but this is happening right now. It's like, this is insane. And she's like, yeah, I can see him. He kept telling me, come out. It's okay. Come out. Oh, it'll be okay. I won't do nothing. Yeah, I don't think so. I'm not getting up from this table. So I
don't trust you.
Hell no, you just shot somebody. Get the hell out of here, man. No way. But it's just crazy though, because there you have that. And then there was like Hidalgo and all these other ones are just, and the Sandy Hook one is just like those poor kids too, man. It's just like, I don't blame kids these days, man. It's like, you don't know what to think. You don't know what's going to happen or who's going to do what nowadays, because it's happening way too often.
Right. Obviously young adults, even adults now, are in a totally different world than like things used to be. Like, obviously, we have had so many traumatic things happen over the course of our lifetime, but also these kids, like some of the kids now were like, the teens were being born during the recession, like in 2008, and then then going on from there's just been so many things, all this stuff ramping up, like mental health ramping up, school shootings ramping up, social media. Like, we don't even know how to deal with all of the news that we're being exposed to. So how are we educating our kids on dealing with all of that information.
Exactly. I think that's a key question to ask is how are we teaching our kids about these things? Because I don't think people are having conversations about this stuff because like one, they don't know what to think, or two, the parents are not even sure because they're not even sure what they're dealing with at that time, and especially the paranoia of these school shootings. It's like you hear school shooting, then you start panicking because you're like, oh shit, where's it at? And then you find out it's somewhere close to where you're at, and then you're like, oh heck no. And things like that. It's crazy though that it's coming to this though. It's like, especially the one in Tennessee was the most interesting one where the parent was like, okay, I want to buy the gun from anyways. This kid has bad intentions. I'm still going to buy him the weapon anyway. So I'm like, what? I think it's great that they're holding people, like more people accountable, the parents accountable for these kind of things, especially that situation, because the guy knew that it was about to get sticky. He knew the kid had bad intentions because he was already telling him about it. And I was just like, oh God, no. It's just like when that information comes out, then you're like, really? You're supposed to be an adult here. What are you doing?
You're supposed to be making good decisions and making informed decisions. Like, why would you do this? Yeah, I think for me, practicing in Tennessee, that one really was a lot for me, just as these are people, like, I'm serving the kids. I have clients who go to schools, not that school, but nearby. And I'm like, now they're going to hear about this and they're going to be even more worried. Like, that was automatically something like, now this worry is even more real for them than it already was. But I think the thing is, if parents are going into the conversation thinking that their kids don't know about mental health or suicide or have never heard of that, they're wrong.
Yeah, especially with the internet and all this. Remember 13 Reasons Why? It's been out for a while now too. You can't tell me some of these kids haven't watched that one before they even edited the original one, because I read the end of that one was just so rough for people to watch. It was just like, you're watching somebody do this and it's like, okay, well, just so you know, this is what it's happening. This is literally what's going on. This girl is literally committing suicide in this video, and you're watching her at the end of the show, and they edited it eventually. And I was just like, well, about time, because damn, what do you mean? Like, I know in the beginning it said trigger warning for a lot of people, which I think is great, but the end one, holy crap. Let me tell you, trigger warning should have not even been it. It should have been, hey, be prepared for what you're about to watch. It's going to be real intense and real to you, and you're watching this young lady do it. And it's just like, I was like, even my skin was crawling because I've been in that situation. I've thought about it before. And it's like, I've been on the edge of that. And it's like, it felt so real, man. I could only imagine what certain diagnosis would have just been shot off by that one. And I know Euphoria was another one too. The one that HBO had with the girl that had the drug problem and things like that. That was another interesting one to see, because my wife, she deals with a lot of things. And she had mentioned, I have to watch it in small doses because it triggers me. And I'm like, I was so fascinated because I'm just like, really, why is that? Because I'm like, I watched it and didn't think anything of it, obviously, because, but when she started talking about it, she was like, yeah, I can watch a little at a time and I have to stop because it may start triggering me. And, you don't think about these things because I'm like, I'm watching it and I'm having the same effect as she is. But I can imagine what the heck is going through her brain when she's watching this going, oh man, this girl is struggling. She's doing drug addiction and things like this and other stuff like that. And it's just like, holy crap, man. And it's like, I think a lot of people are going to say, oh, we're desensitizing kids with that. And I'm like, I don't think so. I think it's time they start to see the reality of what some of these stuff says. It's like, let's stop babying them, because kids as young as 4 can understand a lot of things that we're doing. They may not be able to talk to you, but they can sure as hell tell what's going on around the room too.
Right. And they're picking up on things. Like, that's the thing that a lot of us forget is, we're very quick to say, oh, kids are like a sponge, then treat them like that.
Exactly.
I think, when I was growing up, I was probably like 15, 16 before I really heard any of my friends talking about suicide or self-harm.
Yeah.
Now, totally different age range for them. Some of it is even younger than them. So I think parents have to start having these conversations earlier of like, and I think that even begins at toddler 4, 5, 6, because they can tell you how, like, they may not be able to communicate clearly, but they can at least begin to tell you how they're feeling. So I
Yeah.
think beginning that conversation early as you can of like, hey, express to me how you're feeling. I have clients now, 30, 40 years old, and they're like, I can't express my feelings.
Mm-hmm.
Because my parents did not allow me to do that as a child. And I don't know how. And that is like a really big thing for them. And it's causing people a lot of harm down the road. And I don't think that people, like parents, are understanding that fact of like the things that you do and the things that you do as a child emotional or do to your child emotionally and what you say to them emotionally has lasting effects on them, even if it's one time. Like if one time they come to you and they don't feel supported, most likely your child's going to remember that and start being hesitant to tell you more and more.
Mm-hmm.
So we
Exactly.
have to
You heard it from the expert over there. I'm telling you, you've heard it from somebody that knows what they're talking about. It's not just me saying it. It's Kelsey saying the same thing. It's that these kids at an early age can tell a lot more than we realize they're starting to pick up on, and having the conversation early, I think is the number one thing. And that's like I said, my nonprofit I work with, that's what we're talking about. It's like, we're trying to get the conversation out there. It's an uncomfortable conversation. Yes, because you're talking about death and the different ways people commit suicide, things like that, but it's a real conversation that needs to be had. We need to stop this statistic from becoming negative and make it a positive number.
Yeah, I think one of the biggest worries people normally have is like, oh, well, if I openly ask about it, won't that make them want to
I love it.
do something more, or
Love
won't
it.
that give them more ideas? And it's like, you think that they don't get ideas from their cell phone? You think that they don't like see all of these things on their cell phone?
Mm-hmm.
Shielding kids just isn't an option anymore. When we didn't have all of the technology that we had now, okay, yeah, maybe we could shield them from reality, but we can't do that anymore.
Yeah. Yeah.
Like
I
it
love
used to
it.
be all you had to worry about was the kids talking on the playground. Like, no, that's not even a concern anymore.
Exactly. Yeah. Think about it. TikTok, Instagram, Facebook. They're going to see it somewhere. Someone's going to talk
Yeah.
about somebody did it or something happened of that sort, or some of these actors they see and other people, like Robin Williams for us in the 90s. It was hard when we found out that
Yep.
he was battling so bad. Chris Farley battled real bad too. He was so funny, always put on a happy persona, but like when you really dug into his story, it was crazy.
Yeah.
You see that Chris struggled so bad. Same thing with Robin. He struggled as well. And it's just like you start seeing these things happen, and it's just like, oh shit.
Right.
And now you add in social media, it's like they're going to see at some point that this is going to come across the topic, and it's better for you to tell them versus somebody else that tells them the misinformation about it.
Oh yeah, for sure. And that's it's better for them to hear it from somebody that they think they can trust.
Mm-hmm.
Like, and that builds trust with them if you are open with them and like, hey, this is probably something that you're going to see often. Like, how are you feeling about it? These are things that people are talking about often. How do you
Mm-hmm.
feel about it? Like addressing all of those things and conversations that they're going to have. Also, like, the scary thing is they're going to have their friends coming to them and say, I'm having these thoughts. I
Yep.
want to do this.
Yep.
Your kids have to feel comfortable to come to you and be like, yeah, this is what I'm going, like, this is the game plan. I know that was my first experience ever really, like, I knew what suicide was, but like
Mm-hmm.
my first experience was having a friend coming to me and was like, I'm having these feelings. And like as a teenager, I was petrified. I didn't know what to do. I was staying up late past my bedtime, having this conversation with my friend, and I didn't know what to do. Like, and that's scary. That's also a lot of guilt, a lot of pressure that you feel. Like, oh, what happens if I say something wrong? And then they act on these thoughts. Like, that's not pressure that kids could feel or should
Mm-hmm.
feel. And that's one of the things that I like to educate teenagers on too, is like, there is nothing that you can do for your friend because you, like, especially younger than 16, you cannot drive them anywhere to get them help.
Yeah.
Like, nothing that you can say is ultimately going to help them because you're not that professional. Like, you need to help connect them to somebody that they can trust to get them the help they need.
Exactly.
Like, you can be there for them, stay there with them, like, don't leave them. But, like, ultimately, you need to be working with them to figure out, like, who can they trust.
Yeah.
Because that is, you cannot do anything, and you shouldn't have to carry the weight of that, because you ultimately, like, can't get in a car and drive them to a hospital because you don't have a license.
Right. Exactly. You know, it's interesting though. Just catch you right there, real quick. Is that the aftermath? You know, like afterwards. You know what? A lot of times I hear people say is, "Well, I wish I could have done more." I mean,
yeah.
what else could have you done? Though it's a real question. What else do you think you could have done to help them more? I mean, you don't know anything. Like you said, you're not trained. You're not ready to handle this kind of conversation. I mean, you're trying to be a good friend by listening, but you know, if they're going to do it, they're already going to do it. There's nothing you could have done at that point. You know, they've already got the plan in place and everything else, and you know, things like that. So my question now is, if someone's in that situation and they start feeling like somebody's saying something, what kind of questions should they be asking to identify whether or not they're really serious or they're just having thoughts about it?
So our biggest, like, the biggest research that we see shows to be straightforward is the best way to go. There's 2 trainings that are really helpful. Most of them are free to anyone. And I can, like, send you some links if you want to put it in, like, the show notes. But
definitely, I'll put it down here below in the chat for the links. Whatever you send me, I'll definitely add them right in here so people can get them.
Yeah, it's QPR training and mental health first aid training. I don't know what the age is for QPR, but I know the mental health first aid, they're actually starting to train teens on that. I think as early as, like, maybe 14 or 15 with parental permission, of course.
Yeah.
But those 2 trainings really help, like, teach people how to ask those questions straightforward. So basically, it's not, hey, are you having negative thoughts? Like, now, as a therapist, that may be how I start the conversation. But if you have somebody coming to you and is like, hey, man, what do you think about this? Like, what do you think if, like, what do you think would happen if, like, I drove my car off a cliff? Like, okay, well, like, I think something bad would happen, but tell me why you're thinking about this. Like, why is this coming up? Are you having thoughts of wanting to drive your car off a cliff? Like, at being as straightforward as you can. I think also, just because they're just thoughts doesn't mean that it's not important either. So even if it is, and that's, like, the biggest thing too that I see with teens and parents of teens, is they're like, well, what if they're just trying to get attention? Okay, then why are they trying to get attention?
Exactly.
Like, if things are to that level that they have to pull that card out to get your attention, why?
Exactly. What is it that they're trying? Why are they trying to seek your attention? What is it that they're trying to get? You know, and I think a lot of times people forget that you know, keep an eye on what they're doing too, like monitor their online activities and things like that as well. While we're talking about the subject of just teens alone, it's like I know people are like, oh, that's like real close parenting. No, maybe you should start looking out for signs like that, because you never know if they're having a conversation with somebody else. Yeah, I tried to talk to you, mom and dad, you didn't listen, so I'm gonna go talk to my friends about it. And now I'm telling my friends I'm having these thoughts that are coming up. So, you know, and you're not listening, and then you're gonna be, oh, I didn't know, even know, because you didn't listen in the first place. And that's what I'm saying. Like, when they tell you, like, take that as a badge of honor that they're talking to you, because if you can get them start talking now, it's great to have open conversations about these things, you know, and discuss different things and let them know, hey, listen, these are some things that people deal with. These are what these are, or even teach them as younger kids, like, you know, teach them, like, their emotions, like, hey, this is what anger looks like, so you can see that this person's angry, you know, and explain to them what that is, so you know what they're looking at, kind of thing, you know. And it's just like,
And like you said, I like to touch back on what you said though. You said just because they're having thoughts doesn't mean that they're going to do something. Just because people are talking to you doesn't mean you should automatically jump to conclusions of, oh my God, they're going to do something they shouldn't do. Now, if they continue to talk about it, okay, then maybe there's something that's going on that you need to let somebody know. Hey, listen, so and so is having this. He keeps talking about these thoughts and things, and I'm a little concerned about them, and all those kind of things. Because at that point, it's like, get somebody else involved in the situation. 988 is a great one too for anybody that's old enough to dial a phone number. Just call them, man. That's what they're there for, I've had people come to me in my messages and tell me that, hey, man, I'm thinking about killing myself. And I'm like, okay. And the first thing I do is I ask them, I said, so what's wrong? What happened? I try to figure out, get them to start talking, because once they start talking, a lot of times they feel a lot better afterwards. And I've had a lot of people say, hey, listen, Pete just listened to what I had to say. And they're just like, they're bragging about it. Oh, man, Pete is he listened to everything I said. And all I did was listen to them. Now, am I saying that's how you fix the problem? No. By no means am I saying that fixes the problem. I've had to suggest the number to somebody. I said, listen, man, if you're having this bad of thoughts, 988 is where you need to go. I am not a professional by any means. I will listen to you. Yes, I do run a mental health podcast, and just because I run one doesn't mean I'm an expert. I'm just the average person here learning things that I go. I'm bringing people such as yourself on to help educate other people and know where people can find you and things like that. I am by no means an expert, guys. I listen to you. I'll listen to you all day. You want to come talk to me about it? And sometimes that'll make you feel better, to feel like you're being heard and things like that. You recycle back to that, and it's like, I've been in this situation. I've been through that situation. I've had those thoughts myself. I've been actually on the ledge of it. Me and another person had a conversation on this show earlier last year. And her name is Stephanie Acock. Me and her were talking about it. And Stephanie was literally in Hawaii looking over the cliff. Like, she was literally doing it. It wasn't just me thinking about it. It was her doing it, thinking about jumping off the cliff because she was at the same place, And it's so interesting, because how many of us that when we start talking, a lot of times you'll line up and find out that you're not the only person alone, man. And that's the great thing about this show, is I'm being heard in 10 different countries. So somebody out there is going to hear this conversation and be like, damn, man, I agree with him. We need to start talking about this more.
Yeah, for sure. I think that the thing is too, once you open up that conversation and you begin having conversations with people, will all of them be accepting of the conversation? No. But you may say something in that conversation that sticks with them that they use later on. And I think that's the biggest thing. As a therapist, we have a lot of imposter syndrome. So like, am I actually helping these people? Am I doing enough? All of those things. So that's one of the biggest pieces of advice that I got early on, was even if they don't use what you're saying right now in this moment, even if they're not receptive to it, 2 months, 5 years, 10 years down the road, they may be in a situation again where they take what you were saying. And that's the same thing with everybody, not just a professional. If you go into a conversation and you're having a conversation with people who are not receptive to talking about mental health, and you say, hey, I just want you to be aware, like, have y'all had these conversations with your kids? Or I just want you to know, like, if you're ever having these thoughts, like, I want you to know that you can come to me. Like, I'm not just a friend that we're going to sit and play games with or hang out with. Like, I want you to know that I'm here for you emotionally. And that friend's just like, oh, that will never happen. Like, that doesn't mean that they didn't hear what you said. That just may have been that they didn't know how to address what you said. And then, like, the more that we talk about it, the more that people are going to be aware. And that doesn't mean that it's going to necessarily, like, increase our suicidal, like, risk or increase our rate of suicide just because we're talking about it.
No, I think having a conversation is overdue. And like I said, that's why I put a message out for people that they want to join a panel of us just to have a discussion. We actually have another doctor that's joining us. She has a PhD in behavioral, I can't remember the full thing, but it was something behavioral though, something like that. And she instantly, within, like, I think for like the first hour or so I put the video up, I'm in right away. She wants in. And I'm like, all right, well, this will be interesting because you'll have a bunch of individuals, and then you'll have somebody there that can help, add a little bit of tidbits as we go. And it's going to be the first of many, I hope. I hope we continue to have more people on, because I think more voices we can lend to the conversation, it's the better, and it's great. A lot of people ask me too about, they're like, hey, so is it just people have had lost somebody to suicide, or no? It's somebody who wants to have the conversation. I was like, why do we have to put so many different restrictions on it? Have you lost somebody? Okay, that's cool. Come join the conversation still. Do you remember them? You can mention their name right during the middle of the panel. Give, hey, listen, I'm here because of so-and-so, and we'll mention their names live. It doesn't matter to me. I don't care. Yeah. You don't have to have somebody done it. You just have to have one to take a stand and decide that now is the time we start having this conversation versus avoiding the conversation.
Right. That's the biggest thing, is addressing the elephant in the room. If there's something that, why are we avoiding the conversations that are uncomfortable?
Exactly.
That's the thing. To have major change, and this is things that I tell clients all the time. These are things I tell like people that I'm talking to that are struggling with different things. To get change, you have to be uncomfortable. And that's the same thing with this. Like, on the smallest level to the biggest level of bringing awareness to suicide and mental health in general, you have to be uncomfortable. You have to be willing to go out of your way and do, like, say and have those conversations or post that information, because otherwise, like, people aren't going to know.
Exactly.
And I think with teens, it's such a struggle for some of them, because the majority of them, if they're not having those thoughts or they're not dealing with like mental health issues, then they're the ones supporting those who have the mental health issues. And I always found myself in the supporting role as a teen, but it wasn't like, that didn't mean that it was easy for me. So it still had an effect on me. And so I think that's the thing, is like, as parents, teachers, and coaches, like, everybody has to be having these conversations to make it more open. I've been at schools where I was meeting with a kid at the school, and like, let's say we were walking back to the office, and they were talking to me, and they might have said something like, I'm just going to hurt myself. Not a single head turned. Not a single person like turned around and was like, oh, like, let me see if this is okay. Like,
isn't that scary? That not a single head turned around when that comment was made? And I think that's the number one problem right there, is that why were you not responding? These kids are saying things, and it's like, hey, here's a hi, ding, 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 hey, hi, I'm telling you something's up, and you're just like ignoring the complete conversation.
Of course, like, I had the conversation with the client, but like nobody else. Like, and that's why, like, kids, another reason add to why some of the kids aren't feeling safe in schools is because they don't feel like they can go to their teachers or their staff with information like this.
Exactly.
Because when they are caught saying things like this, nobody's asking them questions. When they're being caught being bullied by somebody else, nobody's asking them questions. Nobody's addressing the situation. So if we're not doing anything about it, like, what are we doing? Because that's where the change has to happen. Teachers are mandatory reporters. I'm a mandatory reporter. Knowing the laws of being a mandatory reporter, especially in Tennessee, then, like, because that's where I know the laws. Mandatory reporting laws are state by state. But you have a duty to say something. If you see something or hear something, you have to say something. But ultimately, I would like to get into a place to where we're all acting as if we're mandatory reporters, not necessarily to like a police department or like an emergency room or something like that, maybe, but like to somebody who is going to help. Like, why are we just ignoring what we're hearing?
Exactly.
And I think, like, at one point it was kind of like just a slogan or kind of like just something people would say, like, oh, I'm just going to kill myself, or I'm just going to hurt myself, and because they were frustrated with the situation. And it's like, you actually don't mean that, don't say it. And I think that if we started having, that's another thing, like I think if we started having consequences for those comments, then people would stop doing them. Like if you had to go talk to a school counselor because you made that comment and somebody heard you make that comment, and you had to go to explain to the school counselor that that was not actually a feeling, that was and not something you want to do, you were just frustrated, and so you just thought it would be something you would say because that's what everybody else says, eventually that's going to stop.
Yeah.
Like, if your parent hears you say that and they pull you to the side and is like having a lecture with you about what that actually means, then you're going to stop saying that.
Yeah. I think that's a really great point there. I think honestly is people making those snide little comments and things like that. It's like, people start taking that stuff serious. When you start really saying that and you get in those situations where people are starting to report that, I think that's what that needs to really start happening. I mean, I think it's a fantastic idea that people need to start saying something like, yo, you don't really mean that. Stop. Don't be saying shit like that, because it's not a joke. Because what if someone said that to you and they ended up doing, and then you heard it and you thought it was, oh, well, they were just kidding, and things like that. Which leads me to my question, though, is that when people are in that situation, people are saying things, what are some things that people should look out for? Like things that they're saying. I know, like, the usual things like people withdrawing from certain things or kind of like fading away from the crowd a little bit, kind of being a little more isolated. Are there certain things that they start saying that we should start being like, hey, red flag, hey, ding, ding, something's wrong here. I need to know. And start asking questions to them, like, and if the worst case scenario, you tell somebody about it, like, hey, listen, so Timmy's been saying these things, and I'm very concerned with what is going on, just kind of like we were just suggesting,
No, I think, so that's one of the biggest difficulties with most parents that I talk to of teens is they're like, how do I know this is an issue? Because our normal teen behavior is isolating away from parents, spending too much time in your room. Like, all of those things could be considered like normal teen behavior. Mm-hmm. But the biggest thing that I normally, like, I always say to parents, especially if they're questioning, like, oh, how do I know my kid is struggling with depression? Like, how do I know? Well, like, are they still wanting to hang out with their friends? So you get to that point, basically the way development works is from when you start becoming preteen teenager, the kid starts reducing the hierarchy of the parent and increasing the hierarchy of friendship. Mm-hmm. So they start to think more about what their friends think of them instead of more of pleasing their parents. So if they're not wanting to connect with their friends, if they're not wanting to be with their friends, if they're not wanting to go to school absences, and like not wanting to go to school and like not wanting to be involved in school, that's a big one, I think, if that's normal for them. Yeah. Now, if you have somebody who just like hates school and never wants to go, and then like that behavior is happening, that doesn't necessarily mean that like they want to hurt themselves or they're depressed. It could just mean like they don't like their school.
Yeah.
But if you have somebody who usually is very active in school, like may not even like the academic part of school, because most kids don't, but like likes going to school for socializing, and then all of a sudden they don't, that's a big red flag. I think if you're talking with people and they continue to make comments about like death, about like, even asking about like what would happen if, like what would happen after, like what does the future look like, or even not talking about the future. So that could be another one for kids, especially older teens who are, 10th, 11th, 12th grade. You have somebody who is very motivated for college, very motivated to like work on their studies. And then all of a sudden, like, there was no longer a care about where they're going to college. Like, nothing was being turned in on time, like those sort of things.
Yeah.
Red flag.
Yeah, I think those are all really great too. It's, just be more observant of what your friends are doing. If you notice them starting to withdraw,
Right.
like Kelsey just said, it could be something that's up, and, maybe you just calling and checking on them a lot of times will help too. It's just like, hey, listen, I noticed that you're kind of standoffish a bit. What's wrong?
Yeah.
And just being a little more observant and more action oriented versus just kind of watching them and not saying anything about it. And that goes for anybody you haven't talked to in a while. Just reach out and ask them, like, hey, how you doing? Things like that. Because you don't know, that one phone call you make, you could save somebody's life right there. They could be like, oh
Yeah.
man, somebody knows I'm still alive and I'm still a person. Even it goes to even to everyday interactions with people. You see people every
Yeah.
day. You just saying something nice to them, that right there, you could have just made their whole day go by, and they're just like, oh man, somebody noticed me and things like that. And like I said, like we've been talking about, it's a tough conversation to have with people, but it's like, I mean, people have these thoughts that go on, they're actual thoughts that go through your mind sometimes, and don't feel like, if you're that person that's having those thoughts, you can't talk to somebody. You can reach out to me, you can reach out to Kelsey, you can reach out to anybody you want. There's 988 if you really need it, like a lot of people out there will listen. You'll be amazed. Like, I don't have to know you to understand, listen to you and give you a sense that you're being heard, because I gladly do it for you regardless. Like I said, I've had random people just randomly hit me up and be like, hey, someone suggested I come talk to you. And, these are, because I'll listen. I don't care. I'll listen.
Yeah.
I mean, I don't care how uncomfortable the conversation gets. I had an actual conversation with somebody, I can't remember what type of schizophrenia it was. She was talking about it. And this person, man, I'm telling you right now, it was just like, it was interesting from the fact that I've never experienced that, but you could tell they were really struggling, man. She was like, her eyes were just going left and right and everything else. And she had this like really like a lot of people would think crazy look on her face. To me, I was just more intrigued about like what's going on. And I'm just trying to get her to talk. And she's like, oh yeah, I don't remember what kind of, I really wish I knew what kind of schizophrenia it was that we were talking about. Oh, it was the one where bipolar's mixed in a little bit. She was saying, the way she described it to me is like she has bipolar symptoms plus she's dealing with schizophrenia at the same time. And you could just see, there you go. That's exactly what it was. I couldn't think of what it was. I'm like, I got it on the tip of my tongue. I looked it up because I was curious. Mm-hmm. And this person, Kelsey, was just like, it was so interesting to me because I'm just like, dude, what the hell's going on? Like, you notice something's wrong with them. And then she started talking, and like she's like doing this, like looking around like this, and this woman's live on the internet, mind you. She's like, all these people around the world can see her doing this, and she's like very careful about how she's talking about it. But to me, I was just like, this is really interesting because it's like schizophrenia is an interesting one too. Because actually, yesterday I talked to a guy who had diagnosed it with like 40 years ago, and he was talking about some of the interesting treatments and things that he deals with, and and destigmatizing a lot of things that people think about it when they think about schizophrenia and things like that too. And then lo and behold, next person I run into, this young lady here, she's talking about it right there. And I'm just like, okay, now this is interesting. Why is it that morning I had a conversation with somebody about it, and then later that night, now I'm running into somebody else. And it's just, it's so interesting when you run into these things. And me personally, I'm curious 100%. I am really curious about this stuff ever since day one of this podcast to now. I've met so many different people. I couldn't even tell you. I could tell you the oh shit moment of the year to happen. I had a guy talking about suicidal ideation live on the show. 30 minutes into the show, he literally starts, Pete, I got to tell you something. I said, yeah, go ahead, man. What's up? He literally goes into the conversation to say the following, and this is exactly what he told us. He said, hey, this morning, Pete, I deal with these problems. I lost my friend to suicide last year, and you could tell it really tore him up because this guy is like really getting emotional. And I'm like, oh shit, what is going on here, man? And like, I'm thinking in my mind, brace for impact, because this is going to happen. Don't react to anything he says. Just stay calm. And he starts talking about it. Kelsey, he's like, I was sitting on my edge of the bed this morning, and I was sitting there with the gun in my hand. And I'm like, oh shit, this dude is seriously going to start talking about, he's been thinking about killing himself. So I'm watching. Lo and behold, that's what happened. He was like, I was sitting there. I was thinking about it. I was on the edge of the bed, and this is he said the morning of when we were going to interview and stuff. And like, he seemed a little standoffish at first. And then I found out why it was. Cause like I said, 30 minutes in conversation, he just started unloading, and I'm just like, here we go. And that's why I choose to run these in a casual conversation, because a lot of times these people open up like 30 minutes into the conversation, you get them going, man. They just start warming up and their personalities start coming out. And he was talking to us, and then he cycled away from it. And then he went back to it again. And after I finished recording, I reached out to a friend and said, "Hey man, have you watched the new episode yet? Were you watching this live?" He goes, "No." I said, "Hey man, do me a favor, go back and watch that and confirm that I'm not crazy, that this man just literally just did what he did." And he really watched it, and he goes, "Yeah, man." He went back to it twice. He went back and came back around and was talking about it again. And I think it was great for people to see, because people understand that this guy he's a CEO, got big things going on, but he still experiences problems, and I think that's a great thing that breaks that stigma. Just because you're super successful, you're doing great things, doesn't mean you can't have mental problems like that. It doesn't make you invincible. You're not Superman and all these other things that people would think you are, just because, you can't have these problems, and that was funny, because a week before, the guy that I had a conversation with was a good friend of mine that I met through TikTok. This young man said that he had experienced the same thing, except for he attempted to kill himself 6 times. Now,
Wow.
based on what society would say, Alex was the type of guy that had everything going for him. He was going to be a Major League Baseball star. He was at the right college position. He had a major league team looking at him, but he didn't tell. Nobody knew that he struggled with this, and a lot of people's eyes were really open to when he started talking about it live on the show. He was like, "Man." They're like, "Dude," he's like, no matter how many messages, Pete, I got it. People saying, "Holy crap, dude, I would have never even known until you said something." And I said, I'm like, there you go, man. Because I always tell people when they come on the show, I'm like, somebody's going to see your story when you come on here and share it and say something. They're going to be like, "Hey, man, like I saw that," and it resonates with people, and it makes people feel like they're not alone,
Yeah.
and things like that. So that's a great thing about the show, is that every time I click go live, I have somebody on this show. It gets more interesting by the minute, because you
Mhm.
start to learn more things, and then the conversation starts to get more interesting when you have other people to say, "Oh shit, I didn't know anything like that," or "I didn't realize that about certain people," and it empowers them to come on here and talk about it.
Yeah. I think the biggest, like, kind of steps of advice that I could give for anybody who
Mm-hmm.
is like talking to anybody who may be like disclosing those thoughts, or even, talking with a teenager in general, is like, one, if they're displaying those thoughts, like, don't leave them. Like,
Mm-hmm.
don't just be like, "Oh, let me go run and get somebody." No, like, take them with you. Like, don't leave them. And if you're on the phone, like, don't hang up. Like, don't leave them alone, because we know that that's a trigger. We know that that's an issue there. But also, and not even with suicide, but just with talking with teens in general, trying to get
Mm-hmm.
people, trying to get them to open up and be close to you. What would you want when you were a teenager?
Yeah, exactly.
Like, because that's one of the biggest things that I strive for too, is like trying to be the therapist I wish I had. Like, I went through multiple therapists when I was a teenager, having some like chronic health issues. And now, like, I had some good therapists, but like, I always strive to be like the therapist that I would have needed, or that I wish I could have been for my friend who was expressing suicidal thoughts, like trying to be that person, like talk to them in a way that you would want to be talked to if you were in their shoes and you were their age. And I think, because going up to a teenager and talking to them like they're a baby that's not what they want. They
Exactly.
want to be respected. They want to be heard. And I think talking about suicide is the best way to bring awareness to it. Posting about it, like, let people know that, like, 988 is a thing. Like,
Mm-hmm.
let people know how real it is, because we are in a mental health crisis. Like, this is a crisis at this point. This is not, we are seeing such big numbers of people who need help, and also who there are limited providers for. So trying to get into a psychiatrist who prescribes medication, the wait list, astronomical. Same thing with psychologists who do like testing, diagnostic testing. Wait list so long. But even if you can't get in with a psychiatrist or psychologist, okay, get in with your general practitioner and get a therapist.
Yeah.
Like, do something. And there's so many, like, if you feel like it's a money issue, which a lot of people, are facing during this time, look out for other resources or find a different therapist, because there are therapists who will see people for reduced rates if you don't have insurance. So just reach out till you find somebody. Like, don't give up on finding help if you need help.
Yeah, don't get discouraged. I agree. I agree 100%. I think it's all great facts. I really appreciate that, though. That's really great facts. I really think that a lot of people need to start having this conversation sooner with their kids and everything else, basically is the takeaway from this whole thing. There is help out there, guys. 988, like I said, we can't say it enough, man. 988, if you ever feel like somebody is at that point, if you need to three-way call them to it and hand them off to somebody else from there. I don't know, Kelsey, that you think that's a great idea too, right? If you just three-way with them, hey, let me three-way and call them with them and be there with them. And it applies the same thing to people that have addiction problems too, is if you're going to be in this thing, you're in it. Don't, like Kelsey said, don't leave halfway through and be like, oh, well, I'll be right back. I got to get a Coke or something. They don't give a fuck about your Coke. Let's be honest. Yeah. They don't care about your damn Coke.
No.
Be in it. And I've told somebody that before. I said, listen, I'm going to let you know right now, if this is your better half as an addiction, I said, you need to either be half fully in this thing or half in. Don't be fucking half-assing it, and I said it just like that to her. I said, I think you need to understand the realism of this is that, he's dealing with something, or he, she, or he, or whatever, dealing with this problem. If you abandon them at any point in their journey, they're not going to trust you the rest of the way. You're not going to get that trust back no matter what you do. I cannot stress that enough. Do not get in if you're not ready, okay? And a lot of us aren't ready. So just be prepared. Once you get into it, it is going to be the roughest ride you've ever had in your life. But you need to understand that once you're in it, that's it. It's buckle in, buckle up, whatever the hell you got to do. Strap up. But do not, I repeat, do not leave these people halfway through because it's too much. Because you're going to do more damage than you just not being there at all with them, because you're going to lose trust. They're not going to trust you, and they're not going to trust other people, because they're going to be like, well, fuck, this person's going to leave me too, and shit like that, and it's so real, and I cannot stress that enough. And Kelsey can tell you too, and the more people that seem to get need to understand that, it's just like, listen, man, it's not fun. Like I deal with stuff that I have going on I don't tell people about because I keep it private, but I can tell you that I've been there in some of these experiences and things like that and other stuff too. So, but as we get ready to wrap this up, Kelsey, why don't you go ahead and plug people where they can find you in case they're in Tennessee and they want to come check out you, check out your practice and things like that. So I know I'll have it all listed down below, guys, in case you're listening to this, you can't see it. Kelsey's going to go ahead and let you know right now, but I got her Instagram and everything else listed down here. And then she's going to send me some more information. I'm going to put it in the description as well.
So my practice is Denny Counseling. It's Denney. Mm-hmm. You can find me at our website, denny-counseling.com. On my website, I'm also in the works of putting up a blog just to have more information to where maybe you're not ready to seek counseling. Maybe you're not in Tennessee and I can't necessarily be your therapist, but I want it to be a place of where people can get resources for trying to help find a therapist.
Exactly.
My Instagram for my business is Denny Counseling as well. And then my personal Instagram is Kesley. I think it's Kesley Rogers. I think so. This too. I got it listed down below. I know that much because I had to look it up this morning. So I'll add in the other one for your business too. So guys, listen, reach out to Kelsey. Tell her, hey, listen, I saw you on Pete vs. Anxiety, she'll love to hear it too, and Kelsey, I'm probably going to suggest you to a couple other podcasters too. I don't know if you're interested in doing some other stuff like that, guys. If you want to be on the show, just be like Kelsey did. Me and Kelsey ran into each other. I think Facebook's we ran into each other on. I do run another one during the week where I have another site I use and things like that. I know. But that's just because I'm trying to get high quality people on top of other people's voices too. That way we get, a mixture of everybody here. Guys, you're always welcome to come share your story here. This is a safe space I've created for everybody to come and talk about this subject. If you want to be a part of one of the panels that I'm getting set up, I've already chosen the first 6 for the first one.
I am doing one for men's mental health as well. I'm going to get together a bunch of people, a bunch of guys together, and just have a conversation about the conversation not talked about enough, obviously, by far. Well, Kelsey, thank you so much for being here. I appreciate you taking the time. I think this was a fantastic conversation. Did you want to do me one favor though? If you could break the stigma for one mental health, any subject you want, you think that you just want to lay it out right now, what would it be?
So the one that is biggest and nearest and dearest to my heart right now is the farmer suicide rate. So farmers are the 4th leading occupation to commit suicide. So farmer suicide is such a big deal right now. If I could bring awareness to that, I think that would be the one that I would like to bring awareness to.
Awesome. I love it. I absolutely love it. Guys, and you know where to find me on Pete Fritz Anxiety and pretty much everything. I'm on X all the way down to TikTok. I'm on Spotify all the way down to iHeartRadio, guys. And as I always say, it costs nothing, absolutely nothing to be kind to somebody. One kind act you could do to save someone's life, or hell, you can make their day. I'm Pete Fritz Anxiety saying, don't ask how your day is. Ask how your mental health is today.